Hi, my name is Debbie Teodorescu. I am an attending physician at Mass General Hospital, and I'm here to talk with you about awake pruning for the patients with COVID-19. Relevant disclosures. All content is for information and educational purposes only, and all opinions are expressed from mine alone based on my experiences taking care of these patients. As a quick recap, we are talking about a 30-year-old gentleman with really very minimal past medical history who is here with 5 days of progressive non-productive cough and dyspnea, whom you've admitted to the wards. So speaking of awake proning, or as my medicine pediatrics double-boarded colleagues say, adult tummy time, awake proning is tolerated in approximately 4 out of 5 patients with COVID-19. And there is often improvement in oxygen saturation and work of breathing in responders within minutes to hours. There is, however, still ongoing research on whether or not it's able to help prevent hard outcomes like mortality, intubation, or ICU admission, as well as how long does this work for after patients resupinate. But I could say, at least anecdotally from my experience, it is often a big help for helping to get patients to at least feel better, and at the very, very least, it's one way by which they can engage in their care. So rapid recap of the physiology behind proning. The idea is you're helping with both the ventilation and the perfusion part of VQ matching, first by helping to prevent overdistension of the alveoli, as well as to better inflate the alveoli that are underutilized. At the same time, you're directing blood flow to areas that are more homogeneously through the lung, and certainly in areas that are going to be better oxygenated. This has been much better characterized, of course, in the ICU population, but even the awake population, the physiology remains very much the same. So who is a pruning candidate? I would argue that if they're okay for the floor, i.e. they don't have an unstable fracture in the face, spine, chest, or pelvis, we really should consider it. I would highlight the caveat that you probably don't want them to do it for the very, very first time in the midst of a bad decompensation episode. Not really because pruning is especially bad, but because we know that in these very tenuous patients, sometimes when they so much as turn from one side of the bed to the other, they can start to rapidly desat. So if they're half a step away from the ICU, that probably is not the time to find out for the first time that they're one of those people. But that said, I have successfully prone patients with BMI of 70. I've successfully prone patients who are three trimesters into their pregnancy. So there really is no great excuse. By the way, for the lady who was heavily pregnant, proning helped us to avert intubation for her, and she was able ultimately to be discharged home and deliver successfully some weeks later. And so we should at least try, is the bottom line. Stop making excuses. The pruning toolkit, my bias is that the pillows are the single biggest and most useful item in the toolkit, but our nursing colleagues have taught me a huge amount. In the daytimes, my colleagues have a dedicated pruning team to help patients, to coach patients through, help to troubleshoot, not so much at nighttime when I take care of the most patients, but that's not a bad thing. If anything, it helps to keep it as this is a low-key thing that you should do every day, the way that you should do instead of spirometry all the time. And so that's at least the way that I generally sell it, and ensuring that they have everything they need for success. And I think the single biggest thing that was useful to learn about was ensuring that they voided successfully beforehand, so that they can have a longer period of pruning and that doesn't limit them. Pruning logistics. Let's be real here. Eyes on the prize. What matters is chest/lung position. Do they want to have some fancy schmancy position? Do they want to have a back massage position like this? Do they want to have a hands up position? Do they want to do a swimmer position? Anything that helps. People have different ways of ensuring comfort. Remember, we prone naturally oftentimes when we sleep as we transition through dozens of positions a night. So it shouldn't be sold to patients as this is something you've never done before. It might be really hard. It should be, well, this is something you've probably done already last night. and we want to encourage you to do this, but on command and as much as you can. I would say that if patients don't tolerate being pruned all the time, which generally people don't spend their entire hospital stay like this, with some notable exceptions, the next best position, I would argue, is bolt upright with aspiration precautions, just because of how significant the airway secretion burden often is, at least at some point in the COVID-19 illness. Everybody will have something different, and in my particular case, I like to use this as a chance to empower patients. It's a little bit of a yoga instructor kind of script, but whatever works and helps people feel better, I am not ashamed to try. So what I will usually say is, we are here to monitor, support you through as you're healing. One thing that is often helpful for patients is to lie on your belly as much as you can, because that helps your lungs expand so they're not pushed up against your spine, but rather it can fully expand so that you can heal. It might not be incredibly comfortable right up front, but please try to stay on your belly as much as you can all day so you can get better faster. Here, let's try it together now. And recalling from the discussion on admissions that we'll often have family members or friends on the line as well, this is a great opportunity for them to, to get in on the action and say, yeah, you can flip and you can stay on your belly. I found that patients with larger bellies, either from pregnancy or from obesity or from ascites, will feel a lot more comfortable when they have their abdomen somewhat offloaded by having a lot of pillows on their sides, plus or minus on their chest. And it's helpful to try an admission so we can at least tell if they would tolerate it and see if they'll respond. It's amazing when I get a pass off from a colleague that says all the things we talked about. Who is this patient? What you've been doing for them? What their oxygenation status is or work of breathing is? As well as, this patient will randomly descend down to the 70s when they're walking, but they recover really quickly. They recover faster when they go into prone position. So that's really helpful to know that that's in our toolkit. Anyway, thank you and stay safe out there.